Hello, everyone. My name is Jim Seberg, and I am the Assistant Director for the Medical Cannabis Research Center at Drexel University. Glad to be joined today by Chris Goldstein. He's a regional organizer for NORML for New Jersey, Pennsylvania, and Delaware, really focused on consumer rights for cannabis. Chris has helped advance cannabis reform issues, including the passage of medical marijuana bills in New Jersey, Pennsylvania, and Delaware. Also Philadelphia's decriminalization bill, and supporting also New Jersey's adult use cannabis ballot referendum. So glad to have you here today, Chris. Been great talking to you over the past couple of weeks, getting this all together. Wanted to pass it over to you to talk about consumer perspectives and cannabis policy.
Sure. Thanks, Jim. And thanks, everyone, for joining us this afternoon. It's going to be 4:20 here, the day after the election. I'm just going to reveal that, in my politics, I've been a big supporter. NORML, the National Organization for the Reform of Marijuana Laws, is both a 501c3 and a 501c4. We have a PAC, we endorse candidates, and we back marijuana-friendly candidates. And John Fetterman's been one of those candidates we backed for many years. His lieutenant governor run, his first run for Senate back in 2016. I've known John personally for a long time. And just before we were discussing a minute ago, Giselle Fetterman is going to be the first woman, the first person around the US Senate who's a well-known medical cannabis patient. So this is a big deal. And today it's been a really, gosh, what a nice day it's been smoking marijuana and watching the two words come across my feeds all morning: Democrat wins. And it's been very nice. Josh Shapiro also wins governor in Pennsylvania. I was quoted in the Philadelphia Inquirer several times during the election cycle because Mehmet Oz and Doug Mastriano both decided to campaign not only against their opponents, but against marijuana legalization, which I thought was just completely goofy. These guys they had a big uphill battle already, and running against marijuana is really tough. That plant is more popular than most politicians at the polls, and really the plant itself is really one of the most popular politicians in America. So Oz and Mastriano go down. They were both against marijuana legalization. Shapiro and Fetterman win, and they both famously for marijuana legalization. So I think that's interesting. Shapiro is sort of your classic stick in the mud, middle of the road, moderate Democrat. As Attorney General, he could have done a lot more. President Biden, and we'll talk about this in a minute, when President Biden in October called for state level marijuana pardons, that's something Shapiro could have done a long time ago. He could have suspended prosecutions and done a lot as Attorney General. Now, he supports marijuana legalization. That doesn't mean he did anything as Attorney General to really deal with prohibition. So that's kind of interesting. So that's the news of today, and that's why I'm having a nice day, and I'm very happy to see Ben Franklin smoking behind me. That's what, I usually do at 4:20 on an election day afterwards. So here, instead, we're spending it all together. So we're going to talk about consumer perspectives today. This is from a rally, and you talked about changing the stigma and people coming out of the cannabis closet. And I'm glad you mentioned that, because that's something that we do every day. When we talk about changing the stigma on cannabis policy as a consumer and patient advocate, for the most part, that starts right in the mirror. Millions of us are cannabis consumers across the country. And because of prohibition, we've had to do a really good job of keeping it a secret, professionally, personally, from our families. And keeping secret like that about something that's such an integral part of your life can make you kind of feel weird about it. And it's important to remind yourself that you're a good person. So one of the chants that I lead, and we say it over and over, is I smoke weed and I'm a good person. So changing the stigma, really, for me as a consumer activist, started for me personally, and I think it goes on for millions of people every day. Just changing the law like we did in New Jersey. Maryland and Missouri last night voted for legalization. But just changing the law is really the beginning. That's the beginning of when people start to feel a little bit of the freedom and the liberty and can feel a little bit more comfortable really being themselves. So that's me smoking marijuana with hundreds of my friends in front of the Liberty Bell. We're going to talk about this later, but President Biden offered pardons for people who got marijuana possession offenses federally. I'm one of them, oddly enough. for smoking a joint on federal land, right there in that very spot, not with all those people around. We'll get to that story later. But smoking marijuana in public has also been part of my advocacy. I used to run marches on South Street, and I'll show you other pictures of some other places. But smoking marijuana in public is a part of changing the stigma. We still, have a lot of laws, even after legalization, and regulations against smoking marijuana in public. But I'd like to change that too. In New Jersey, a lot of the shore towns are against marijuana legalization. Even after we passed it, they've passed ordinances with no public smoking, no retail stores. But we have a dog beach. We actually have a beach just for dogs in New Jersey. And we have a nude beach. We have a clothing optional beach here in New Jersey. It's actually on federal land at Sandy Hook. So I've been arguing that we need a marijuana beach. I think that there should be one beach where you can smoke marijuana in the legal state. Just like one beach would be nice. Consumer perspectives. Earlier this year, I filed a price gouging complaint against Curaleaf, one of the largest medical and recreational marijuana companies in America. Curaleaf is a curious company. Here where I live in South Jersey, they have essentially a monopoly on the adult use here right now at the moment. We'll talk about that rollout here in a minute. But that's the reason I filed a price gouging complaint with the state attorney general in January is because Curaleaf operates in Maine. And in Maine, they sell an ounce of marijuana. I have to say this slowly and let it sink in, because if any of you buy marijuana, this is going to blow your mind. Curaleaf sells an ounce of marijuana for $60 every day. Okay, let me just let that sink in, because an ounce of marijuana in the New Jersey or the Pennsylvania cannabis program will cost between $200 and $480. That's the medical program, $480. The average price here in New Jersey is over $300, $350 for medical cannabis. But Curaleaf sells it for between $60 and $100 in Maine. And what's crazy is that New Jersey patients have reciprocity in Maine with their card. So if they can drive to Maine, they can get that price with their New Jersey medical marijuana card. But if they go to a Curaleaf here in New Jersey, an ounce of marijuana, pretty much the same product, will be between $250 and $480. So I filed a price gouging complaint because when it comes to adult use cannabis, I'm sure that we could all argue that there's room for a luxury level of product, I guess, for those who can afford it. But when it comes to medical cannabis, I feel like $480 an ounce is price gouging, because I do believe that what they're charging in Maine, $60 to $100 an ounce, that's laboratory tested ounce of medical cannabis in Maine. You can look it up. Go to the Curaleaf Ellsworth, Maine menu. Look up their sales. They're great. But that's the thing. Like, I believe that New Jersey and Pennsylvania patients should be paying the same price. I think that an ounce of medical cannabis should be $60 to $100 for laboratory tested, fairly good quality cannabis. I think that's a good baseline. You want to go up from there, that's fine. But right now in New Jersey and Pennsylvania, we're selling some of the most expensive medical cannabis in the country. Pennsylvania's medical marijuana program director earlier this year called out the pricing. That's before he left the program. We have a new director now. His name was John Collins. But in March of this year, Collins was on his way out, and he decided to do like WikiLeaks of medical marijuana price info and the price in the program. We had never really seen any other data like this in any other program. So this is kind of cool. He put together a list of what the retail versus the wholesale price per gram in Pennsylvania was. And he released it. That's just a slide from his presentation earlier this year. And you can see that the price wholesale was going down, but the price to patients was not going down. And when we talk about price gouging and corporate profits, a lot of this sounds very, lofty. You think it's limited to OPEC and oil or, big energy, but it's right here, as clear as it can be in Pennsylvania's medical marijuana program. And Collins is now gone. He's not the director. He is not involved at the Department of Health any longer. And the price is about the same. There's a Trulieve actually bought some dispensaries in Pennsylvania earlier this year. And they have been because I track the prices, and we'll talk about this in a few minutes, but I track the prices in both Pennsylvania and New Jersey in the medical programs and the adult use program. And I haven't seen much of a decline, except that some of the dispensaries like Trulieve and some of the others are selling ground flower for pretty cheap. But on the whole, and let me be clear, $13.40 a gram, that's about 40 bucks an eighth, 60 bucks an eighth. This is not affordable. We're not in the realm of affordability for working class patients or consumers. This is price gouging. Okay, so when it comes to prices, we have a problem from a consumer perspective. Most patients have admitted on many surveys that they don't get, and we'll go back to that. Most patients are not getting 100% of their medical cannabis at the dispensaries for good reason. It's the price. It's very simple. And the same is true for adult use cannabis. When the price is $60 an eighth plus a 30% tax, nobody can afford it. It's that simple, not with a competing underground market at $200 an ounce. It just doesn't happen. So let's talk about adult use in New Jersey. The adult use dispensaries in New Jersey are right now, all of them are corporate owned. There are no small business dispensaries open yet. All of the open adult use dispensaries are in parallel serving medical marijuana patients. We'll talk about in a minute if that's a good idea or not. All of these dispensaries put forth what was called a patient care plan in order to open as an adult use dispensary. I was there for those meetings. I listened very carefully. I read through the patient care plans. They haven't really followed them. They promised curbside pickup for patients. They promised delivery, home delivery. And by the way, Pennsylvania and New Jersey allowed the medical marijuana operators to do curbside pickup and home delivery under special emergency rules under COVID for the last almost 4 years. And none of them have done it. I mean, I don't know how you could leave more money on the table than delivering people marijuana at home. Okay. Seriously, first delivery service to actually work in Philadelphia for medical cannabis, billion-dollar business, I swear. So anyway, let's get back to what the adult use prices are in New Jersey. They're astronomical. $65 an eighth, $55 an eighth. I mean, we're talking like $500 an ounce. That's before the tax. Okay, we have a living wage here in New Jersey. It's $13. I know that hasn't made it across the river to Pennsylvania yet, but we do have a living wage here in New Jersey. It's $13 an hour. That means that if you work 40 hours a week, you're going to earn $520. You can't afford an ounce of weed for a living wage at 40 hours. Okay, this is what we call hyperinflated prices, or I guess what some of us remember what the price for Kind Bud was in our dorms in 1994. But this is out of scale. People cannot afford $60 an eighth plus tax. That means a walk out the door price, even with a moderate tax, of like $72 an eighth. An eighth of marijuana, if there's anybody here who doesn't know what an eighth of marijuana is, it's about just under 4 grams. We're talking like 4 joints. This is a joint, all right? This is like not even, this is like a half gram joint. So you might get 10 of these. But I can go up and buy 20 cigarettes here in New Jersey for $11. I can buy 24 bottles of beer for 28 bucks. But for 4 joints worth of marijuana, they want to charge 60 bucks, and people are not buying it. I mean, they do not have lines out the door for this stuff. It's not like they were like, oh my gosh, everybody from Pennsylvania is going to flood the market in New Jersey and drive across the river and buy weed. Not for $60 an eighth. They can get a better deal in Philly, I'm telling you. So these are all the prices in New Jersey. I mean, there really isn't much variation. I found some $40 eighths but even that's expensive. I mean, that's 300 some odd dollars an ounce. How do you have a party for $500 an ounce, Jim? Seriously. I mean, I could throw a Super Bowl party with 2 cases of beer and it'd cost $50. But if I wanted to like smoke out 50 people, I can't afford it. Like, I mean, living wage, it'd be 2 weeks worth of work. So there is a major, as a consumer advocate, the thing that I'm hammering regulators and politicians on is affordability. Is that ultimately the failure of programs like California and medical programs like New Jersey and Pennsylvania is that access is being limited by extreme pricing. And it's, I was trying to make people understand this. Like, imagine if they ended alcohol prohibition and they opened a liquor store and the only thing available were $1,000 bottles of champagne. Yeah, liquor's legal, but it's $1,000 a bottle for the champagne. So this is what it's like here in New Jersey. Again, Pennsylvania and Delaware residents are not flooding over the river to New Jersey to buy $60 aids. Most New Jersey residents, there was a novelty day where there were lines out the door when they first opened. There are not lines out the door of these places. I mean, the $60 eighth is for somebody who doesn't have any better connection. And that is not most cannabis consumers. So on prices, what's interesting, as an advocate, I have one thing in Pennsylvania that's interesting. So that was New Jersey adult use. Let's come back to Pennsylvania medical. The Pennsylvania Act 16, which is of 2016, which is the medical marijuana law in Pennsylvania, has a section 705. This is the only statutory language in the entire country in any medical marijuana bill related to price control. And there it is on the screen. The Department of Revenue and the Department of Health have actually conducted the price review. Earlier, I showed you the slide, John Collins putting out the wholesale versus retail pricing. That's the price review in this section 705. It took several years for them to complete it. But the price review is ongoing. They keep collecting the data on this at the Department of Health and Department of Revenue. And it says if there's an unreasonable or excessive pricing, they can put a price cap on medical cannabis. Like, wow. Imagine if they did that. Imagine if they put a price cap on medical cannabis. I think it would be a good idea. In Pennsylvania and New Jersey, an emerging area of legislation is the concept that we will allow the medical insurance programs, like essentially state Medicaid, to cover the cost of medical cannabis, which is probably a really good idea. But taxpayers are going to have to get a good deal on this. They can't pay a price gouged rate for that. So Curaleaf thinks that they're going to hold out for the day when taxpayers are going to fund a $480 ounce, even though they're selling it for $60 in Maine. So we've got to control prices in order to get patient access to the level that it needs to be, which is health insurance and good regulation. And the good news in New Jersey, although prices suck, we actually did stop arrests. New Jersey was arresting 100 people a day. Every day, 100 people in New Jersey were getting arrested for marijuana possession. So that stopped in February of 2021. And a year later, the impact was pretty huge. You stop arresting 100 people a day, you end half the drug war in New Jersey. And it wasn't just legalization that did that. Voters in 2020 here in New Jersey, I was one of nearly 2 million voters who voted to legalize retail cannabis. But that was a very, very narrow worded thing. There was nothing in there about equity, and there was nothing in there about record expungement or how we were going to stop arrests. That had to go back to the legislature, and we had to fight for it. So one of the things I was involved with was a decriminalization bill in New Jersey that passed along with the retail regulations. And that meant that we were going to stop all arrests for possession completely, but we also stopped arrests for dealing an ounce or less. And we also stopped arrests for all ages. Now, that's something I carried over from Philadelphia. Jim mentioned back in 2014, I helped write the decriminalization ordinance that's still in place in Philadelphia with then Councilman Jim Kenney, who's now the mayor. And one of the things that we did in 2014, it was a big innovation at the time. And man, did they fight us on this, fought us so hard on it. Like Michael Nutter, one of the things that, the mayor's office didn't like was this provision at the time, but Mayor Nutter signed this bill. It applied to all ages too. A lot of decriminalization ordinances, like the one in place in Delaware today, that only applies for adults age 21 and up. They'll be even meaner to you if you're under 21, which always seems silly to me. But when we went to pass the 2014 decrim ordinances in Philadelphia, we made it apply to all ages, including juveniles. And arrests went down 90% within the first year. I mean, a credit to the implementation there by city officials. And they went down not just for adults, but also for juveniles. So when we went to do the same thing in New Jersey, after the 2020 vote, a lot of us, and to their credit, Senator Teresa Ruiz here in New Jersey, and also Senator Troy Singleton, they wanted to make sure it applied to all ages. Because one of the biggest mistakes of legalization early on in Colorado and other places is that it defined legalization as for adults over 21 and older, and it left the question of what happens to those under 21 out there. And that's a problem, because under 21-year-olds got arrested a lot, and we don't want that to be a negative impact of legalizing cannabis. Another thing that happened earlier this year was that Delaware failed to legalize marijuana. I mean, whoa, who could have thought that in June of this year? I mean, this was one of the most bitter, crazy fights I've seen. Delaware had several bills. I mean, they went 2 or 3 times at this year. They have a very small legislature, the second smallest in the country. Only Alaska has a smaller legislature, by the way. 62 members of the Delaware legislature. And it's not just Democrats, but it's a majority of Democrats. And Delaware tried a retail cannabis program with equity. Well, guess who came out against that? Yes, the police unions, they came out against it. But who else came out against it was the medical cannabis industry of Delaware. Some of the biggest players, corporate too, like Columbia Care, actually showed up at a hearing to testify against full legalization. Everybody was floored, couldn't believe it. I mean, there's a lot of people, advocates, hardcore grassroots folks like me that for years were like, man, these corporate guys are against us. Well, in Delaware, they showed up against us. They came out to testify, and that was surprising. And it worked. The industry held back legalization in Delaware. And ultimately, the legislature failed to pass the retail legalization bill by 1 stinking vote. They did pass a bill that would have decriminalized an ounce of marijuana or less. And the governor, John Carney, he becomes the first Democratic governor in America to veto a cannabis reform bill, and he vetoed the 1 ounce decrim bill, which is crazy because a few months later, we come to October, and that's exactly what President Biden is asking every state. So Delaware was a heartbreak this year. And again, we're in November now, so the legislative session's done in Pennsylvania, and it's done in Delaware too. So we're not going to see marijuana become legal in Delaware because the session's already over. And that's it for this year. A lot of the lawmakers who failed to do this actually lost their seats in the State House this year. There's going to be a bit of a change next year, some younger blood coming into the State House, some fresh voices. I think Delaware, after President Biden's announcement this year, is probably a sure bet to win legalization next year. Pennsylvania. Part of what I do is look up the data on arrests and release analysis of that for national normal each year in Pennsylvania. It's interesting because Pennsylvania has one of the few states that actually has a lot of transparency on this data. Now, the system changed over this year, but I had to annoy the crap out of the state police to get this data this year because they changed from the Uniform Crime Reporting System to something called the National Incident-Based Reporting System. But if you look on the screen is some of the interesting tags out of that data this year. First of all, Pennsylvania is still arresting. Last year, they arrested 13,000 people just for possession. And it sucks. Not in Philadelphia because we decriminalized marijuana, not in some of the other communities that have downgraded possession, like Harrisburg and Pittsburgh and things like that, although Pittsburgh is hopefully going to do better under Mayor Gainey. But in the rest of the state, and what's interesting is that it's Republican areas that have not decriminalized cannabis where we're seeing most of the arrests, because I can actually look at the county by county data, and I'll send this to Jim. He can send it around. You can look at this data yourself too. But yeah, it's Republicans are arresting themselves for marijuana. As I mentioned, Dr. Oz and Doug Mastriano, they're against legalization. Republican counties are showing a lot more arrests, but they're arresting themselves. It's really weird. Democratic counties like Philadelphia have decriminalized. The sad part is that the racial disparity, even in the rural counties, is getting worse. So Black residents only make up about 12% of Pennsylvania's population, but they're making up like a large portion of marijuana arrests, 40%, 50% of marijuana arrests, depending on what you're looking at in the data. Some of those examples, again, 1,350 Black women arrested for all substances in Pennsylvania last year, 68% or 919 of them were for cannabis. That's striking data. Juveniles, 1,200 people under 18 years old arrested for all substances. 87% were for marijuana possession. I mean, maybe they're trying to be nice to these kids and they caught them with heroin too, and they're just charging them for the weed. I don't know. But at the end of the year, it looks like prohibition comes out really hard on women, Black residents, Black women, and juveniles of all colors if you're young. So that's the reality of the data in Pennsylvania today. So we can talk about the multi-billion-dollar cannabis industry. We can talk about the legislation that's been passed in Pennsylvania over the last couple of years to support that industry. Hey, wasn't it last year that they passed a bill that said that you could remediate moldy flower in Pennsylvania by turning it into hash oil? Oh, that's magic, right? That's some cannabis industry magic right there. That doesn't sound like science. That sounds like magic. So is that a safety program? Jim and I were talking before. In Pennsylvania, they had a huge recall of products in the program. That guy, John Collins, who was complaining about prices, he issued one of the biggest recalls of medical cannabis products in the country. And the industry came back. Oh man, the empire struck back. They went to court and they got an injunction, and those products are back on the shelf for patients. Are they safe? Just because the court injunction? I don't know. And that's the question. This stuff is sold at a regulated level, medical cannabis, adult use cannabis. It is sold at a premium price. And it's sold at that premium because it's supposed to be safer and it's supposed to be regulated. But if regulators can't recall products and we don't know what's really in it, is it safer? Is it better? And is it safer and better while 13,000 people are still getting arrested for possession in Pennsylvania if it doesn't have the right label? Is that safe for anybody that everybody's getting arrested for anything? So I don't know. Pennsylvania is in a tough place. One of the questions Jim said before is, I want to get back. I want to make sure I get the question right. Is strengths and weaknesses of the Pennsylvania medical cannabis program and the New Jersey legal marketplace. How do you compare and contrast them? Well, the big difference is really that the 2016 Act 16 in Pennsylvania had no equity in mind. It is the most corporate-friendly medical cannabis bill in America, period. It is not built for any equity. There were a couple small business winners of permits in Pennsylvania, but they're all gone. They've all been bought out. There isn't one left. So what you have in Pennsylvania is a very consolidated corporate atmosphere for medical cannabis. None of the real, most of these businesses are based out of state. Actually, one of the interesting things I found out was that all of the large corporations, name one, Curaleaf, Tilray, Canopy, any of them, guess where they're all incorporated? All of them are incorporated in Delaware. So that's kind of weird, right? They're all Delaware companies technically. Well, in the case of Curaleaf, the question is, it could be a Russian company too, but we don't have to talk about that today. You can look up, is Curaleaf a Russian company on Google and find out all you want on that. So that's, compare and contrast. New Jersey is trying. So along with the corporate operators who are the only people selling adult use cannabis out of medical dispensaries right now for a premium, they do have about 300 what they call conditional licenses out, a lot of them to what we call micro permit holders. These are very small businesses looking to be in cannabis. We also did something in New Jersey earlier this year where we made it available through the New Jersey Economic Development Agency and the small business centers, not the federal ones, but the state ones. These are now available to these small cannabis businesses. And prior to passing special laws, they weren't. So part of the problem for a small business coming up in 2022 is that real estate is nuts. And if you say you're interested in the cannabis, all of a sudden that $10,000 warehouse, we'll charge you $40,000 for that instead. So it's really tough to be an operator and put yourself up. So having some available funding from the EDA, having some guidance from the New Jersey Small Business Association, that's big help. We're never going to see until there's a major change in the law and there's a major change in the program as far as the medical program goes. We won't see anything but corporate consolidation in this program in Pennsylvania. I don't know if it's good for patients. I always thought that big corporations would sell marijuana really stinking cheap because they would want to sell a lot of it. But that has not been true. They have charged a premium for it, and that's kept a lot of patients out of the dispensaries and out on the street. I think that what's missing in both Pennsylvania and New Jersey, and what's weird about this, is that both states prohibit home cultivation for patients, and they prohibit home cultivation for adult use here in New Jersey still. The industry also fought this the industry is famous for fighting this. So these corporate operators like Columbia Care, a memo leaked in the New York also legalized cannabis and has medical cannabis program. Columbia Care was against home cultivation up there, even though they're allowing it for medical patients. So that's why the price is so expensive in New Jersey and Pennsylvania. Patients have no options. There's no home grow option, and there's only very few dispensaries open. So that's why prices remain extremely high in both these states. So I think that's a big change that could come here. I mean, I think that's what's missing from both programs is both New Jersey and Pennsylvania. We need home cultivation. One of the other questions is why is it taking so long for New Jersey to open? Okay, so the corporate operators who got their switches flipped, they had everything in place. Their location, they already were regulated to grow. They're vertical entities. They have everything going for them. And they're wealthy, big corporations. So they don't have to start up. They're literally selling adult use cannabis out of existing, and in some cases, they've been around for almost a decade, medical cannabis dispensaries. So it was easy for them. Why is it taking so long for the small business people to start up, or anybody else other than the big corporate guys? Again, it gets back to this weird timing of the program. It's 2022. I understand there is a major real estate crunch, but especially for small business people, like I could start like a bakery business out of my house, but I can't start a marijuana delivery service out of my house. So I think that those rules are going to need to change before you really see a broad, kind of small business base and with one or two people running a small company. But it's the real estate. It really is. I hate to harp on it, but it's true. There are not enough people who are investing in business incubator spaces, and they make it very difficult under the regulations. They're not allowed, these small businesses, like let's say I was a real estate developer and I wanted to put up like a flea market for marijuana, and I wanted to have stalls for small businesses. They wouldn't let you do it. They can't be right next to each other. They have to be 1,000 yards apart or some BS like that. So they make it very difficult to foster these small businesses along. And that's one of the reasons why it's taken a while. Also on the questions, I hope that gets to it. Critics say that the Pennsylvania medical marijuana program is pseudo-recreational. Do you agree? And what's the best solution to address this perception? That is a great question, because I was there when the police and a lot of extremist Republicans leveled that against medical cannabis. And in 2015 and 2016, I was the first one to say, oh, no way. This medical program is going to be well regulated for seriously ill patients. But the truth is that it's a privilege access program. I mean, let's be honest. Because doctors don't participate and because you have to pay extra for a medical marijuana card service, and then you have to pay a premium for the products, essentially $300 an ounce or more, I do think that it's essentially a privilege access program. I'm not sure it could be called pseudo recreational because it's so damn expensive. Who can afford it? But if you are wealthy enough, you could use the program like that. Sure. That's I think the way to deal with that, though, is that mainstream doctors need to participate. Period. That's the big difference between what I think makes it a legitimate medical program and a pseudo medical program, is because the promise was that doctors would be in the loop. And it's not the fault of the program, it's the fault of the medical professionals. Doctors just aren't participating.
So we have a follow-up question on that, Chris, from Larissa
Yeah.
here in our audience. Kind of if we pursue recreational legalization of cannabis, both on a state level and federal level, what impact can we see, in your opinion, for the medical programs specifically? Looking at other states that have both adult use and medical, what would that look like?
Yeah, that's interesting. We were discussing this before about the federal bills and what the broader concept is. So ultimately the MORE Act and the CORA Act, which is Chuck Schumer and Cory Booker's bill. I'm in Cory Booker's district, by the way. I vote for Senator Booker. I'm a big fan. And essentially, it would leave the FDA and the USDA in charge of some of those medical questions. And we have to wonder if they are the correct entities. What would happen to the medical programs and the adult use programs with federal legalization? That's a good question. It depends on what that looks like. So what happened recently, okay, and we could start talking about this. What President Biden did, the pardons are a big deal. We'll talk about that in a minute. But President Biden sent a letter to the Secretary at the Department of Health and Human Services asking about scheduling. Okay, so this is where we get into the scheduling question. Marijuana, as many of you know, is in Schedule 1 of the Controlled Substances Act of 1970. And the question has been, should marijuana move around into Schedule 2 or 3 or 4 or 5, or should marijuana be removed completely from the CSA? We call that descheduling. Now, I have long been an advocate of descheduling cannabis. This is not a new idea by any means. When the CSA was created in 1970, almost immediately in 1972, officially, people were saying we need to remove it from the CSA. I want to point out to everybody that two things that have never been in the Controlled Substances Act are cigarettes and alcohol. So it just seems goofy that marijuana would remain in there in any way. Some would argue that marijuana should move down in scheduling to Schedule 2 or Schedule 3. I disagree with that. I do not think that the Controlled Substances Act of 1970 is the correct vehicle to regulate cannabis federally in America, period. It needs to be removed in order for it to be regulated. Now, let's play out some hypotheticals. If you move marijuana to Schedule 2 or 3, it would essentially undo the medical marijuana and adult use programs of America. It would be very tough to equal that stuff out. But if you deschedule cannabis, if you remove it from the CSA completely, then the state laws stand much easier and are much more, so it, like former Governor Raymond Schaefer of Pennsylvania said in 1972, he was a Republican, actually, he was a Republican constitutional scholar, and he argued for descheduling with President Nixon. And I believe that the argument stands today, that it's the best, most constitutionally sound argument for how federal cannabis policy should proceed. It should be descheduled. That is what Schumer and Booker's bill does. That is what the MORE Act does. It deschedules cannabis. And, that would have to happen at the state level too. We have Controlled Substance and Cosmetics Act here in Pennsylvania, where marijuana was also scheduled. So we have to do that at the state level. That's what should happen. Let's get to that. So President Biden issued this announcement on October 6th. It was the October surprise. And it was about pardoning people like me. And I'm actually a recipient of this pardon. I'm waiting for the certificate, though. I haven't gotten, the Department of Justice hasn't created the certificates yet. But this is where I am. And also is the scheduling argument, which is really interesting. What does it actually mean? If any of you are interested in a weekly update, really awesome graphic journalist lives here in Philadelphia. His name is Brian Box Brown. And he has a strip called Legalization Nation. And if you look it up on Instagram or Twitter, you can see it there. And this is a nice explainer. And I'm sure Jim can send you the PowerPoint. You guys can read all that. How do you get a federal marijuana violation? Who is eligible for it? It's very narrow. So people who are not US citizens that got caught on the US border with some marijuana, they're not eligible. This is my ticket for smoking marijuana in front of the Independence Hall National Historic Park. And this is how I got a federal marijuana offense. They actually took me to court for smoking a joint. That's us smoking in front of the White House. I didn't know the National Park Service had riot gear, but when we declared that we were going to smoke marijuana, they showed up in riot gear. I guess they have riot gear for like bears and coyotes when they have like coyote riots, but they had it for us. So this was back in 2013. And when people ask me, oh, they're like, Chris, you know, and again, I'm a Democrat. I voted for President Biden, voted for President Obama. They're like, Chris, were you expecting this President Biden announcement? I'm like, geez, I've been expecting this. I was like waiting for this announcement the entire Obama administration. Like I thought this was going to be way back in the day. That's why we were protesting. Anyway, they were not nice to us. They took us to court. That's N.A. Poe. He owns Poe's Sandwich Joint. That's over on 5th Street. He was also arrested with us doing this kind of thing. That's me actually smoking the joint just before I got arrested. And that joint right there, that's, I mean, I was fined $3,000. I spent 24 months on federal probation, and I have a permanent federal criminal record for that joint right there for 0.5 grams of marijuana. That's my lawyer. Don't worry, it didn't stop my activism. That's us in front of the Liberty Bell. We had pop-up weed gardens in front of, or the Art Museum on Aikens Oval, which is a really great place to smoke weed. So this was in October of 2016, and the day that decrim went into effect in Philadelphia was October 20th, which I always thought was awesome because it's 6 months after 420. And so that we get to have, you know, a celebration twice a year. We get to have 420 in Philly and then 1020, which is the decrim celebration. This is 1020 2016. And as promised, that's a picture of my knee. If you're wondering why I'm a medical cannabis patient, that's what I did to my leg this year. I went to a skate park and got on a skateboard like I should not. I'm 46 years old. I just like left my brain at the door. And that's what I did to my knee. So when I talk about like sitting in the hospital and not taking OxyContin, I seriously was not taking, they were begging me to take OxyContin. They're like, Chris, if you don't take OxyContin, you're never going to make it. I was like, nah, just give me the cannabis tincture. I'm good. So now I'm fishing. I'm like doing a lot better. You can follow me on Twitter at Freedom is Green. Very stoned I will be, good person I am. That's how I feel after this election day. I wanted to leave. I wanted to get, I'm speeding through the slides and get to the rest of the questions at the end here. So yeah, let's finish up the questions here.
Yeah, so we have a follow-up here from Dr. Kim, chronic pain specialist, talking kind of about how we did before with kind of going to an adult use system and the impact on medical programs. And certainly can talk about kind of what Dr. Nora Volkow had talked about with children's use rates. How do you account for children potentially increasing their use? And then how also with other like medical conditions, how do you balance that between like an adult use program and a medical program in terms of addressing those through regulation?
I think, you know, again, I did not see these medical operators like Curaleaf and Columbia Care actually fulfill the promises they made to patients. They promised that they would have discounted prices, they would have more strains available medically than they did adult use, and that they would have easy access, basically special hours for patients, home delivery. You know, patient access means, you know, what's interesting for chronic pain and medical cannabis patients, I think what's interesting compared to other therapies and medications that they may take is that they're not going to use medical cannabis for like 2 weeks or a month or 6 months. Usually these patients become patients for their lifetime. So this is something that they're incorporating into their daily routine. Whereas other therapies and even analgesic therapies for pain are shorter term. They try this and maybe it'll work for a time. I think that's a good thing. When it comes to chronic pain patients, there are a lot of options with cannabis. You can vaporize it. You can use a vape pen. You can smoke it. You can try edibles. You can use suppositories. You can use all those things at once. And the great thing is that if you use a suppository, smoke a joint, and take 1,000 milligrams of tincture, you won't die. So, as opposed to a lot of other therapies where you're dealing with chronic pain patients where they're just on the edge of a dangerous amount of pain medication to feel okay. So I think that for chronic pain, it's especially good because cannabis, no matter, even if they end up, using more than they should, or in some cases, way more than they should, it's not going to be a lethal dose. When it comes to children, I think in all the programs we've seen that youth use goes down after marijuana is actually legalized, and we have some education programs, and it becomes a lot more boring. When marijuana is legal, it is invariably more boring. That is true. I don't think that kids are getting any of the regulated products. They certainly can't afford a $60 eighth, and the dispensaries themselves are locked down like Fort Knox. So they actually had a test in New Jersey where they had they paid a 17-year-old, the regulators had a mystery shopper, 17-year-old. They couldn't buy any marijuana in the program. So that was one. So, and that's better than cigarettes. I mean, they send mystery shoppers in who get cigarettes underage all the time. Same thing with alcohol. So cannabis is closed off from that. When it comes to accidental stuff, I think that some of this is hyperbolic. Kids do encounter all kinds of things accidentally, whether that be household chemicals, alcohol, or tobacco. These are things that happen. I think that what's sad is that in some states, like here in New Jersey, like if your kid happens to eat some edibles and you call for medical assistance, you could still face criminal charges for it, even though it's legal here. So I don't think that parents should face criminal negligence if they're being responsible and responding to their kid getting into the cannabis as they would respond to their kid who might get into alcohol at a party accidentally or something like that too. So I think that that's a tough area. When it comes to actual teen use and stuff like that, it all seems to go down after legalization. I always thought that after legalization, teens would be more honest about their use. But the truth is that to a lot of kids, marijuana is a normal part of the fabric of society. Whereas like my generation from the 1990s, it was much more like cool and hardcore to smoke weed. Today, it's like, whatever. It's like so common. And, these kids are living in a world where, they're being peddled a lot of stuff at gas stations that probably doesn't have any cannabinoids in it at all, but is labeled as such. So they're living in a different world for this than I grew up.
So we have another question here, Chris, from Professor Werner Simon. She's a law professor here at Drexel. Wanted to know if you were charged with federal possession 21, the USC 844. Asked if you're a felon, if that's a felony, and still being able to vote.
It is not a felony. I was charged under 36 CFR, which is actually possession of a controlled substance on federal land. It was, and in the definition there, the actual charging document, it's the same thing as if you bring alcohol into federal land, which is kind of funny. But that's what the charging was under the CFR for the National Park Police. My sentencing was under the federal code of the 21. But it's not a felony. No, it's a Class B federal misdemeanor.
Great. We have another question here from Larissa, talking about kind of zero tolerance laws in a state like Pennsylvania, specifically when it comes to driving. How can policymakers pass legislation? Have you seen anything out there that really kind of makes a good case for both protecting public health with driving under the influence, as well as kind of protecting medical patient rights?
Legislation has really tried to split the difference on this by creating thresholds. again, Pennsylvania has a zero tolerance per se policy. So any amount of THC in your system convicts you of a DUI here. It's one of the harshest policies in the country. However, other states haven't exactly gotten this right. Setting a very low threshold, say 5, they put it in nanograms per milliliter of THC in your blood usually. So that's what we're talking about, 5 ngml. So 5 ngml would be like really small amount of cannabis in your blood. For instance, the US Army and the World Anti-Doping Agency recently adopted similar guidelines. I believe is 150 ngml. So like if you show back up at a base and your commanding officer thinks that you're high on marijuana and they give you a test and you're below 150 ngml, which is like a lot actually, you can, pilot your attack helicopter or drive your tank. And the World Anti-Doping Agency, which used to have a very low threshold. I mean, you saw this earlier this year with Sha'Carri Richardson in the Olympics, where she was kicked out for a low threshold of THC. They raised the threshold of THC almost to, I believe, over 100 ngml. So, that's a big difference. So the DUI laws being 5 ngml, that's very, very low. So that's, it's almost zero tolerance. So some states have adopted thresholds that are higher, 15, 20 ngml, but this debate is not really, it's very tough to stay in the realm of science. It's very arbitrary. When it comes to law enforcement and other people having a tool that they feel comfortable with on the roadside, gauging people's THC intoxication, I mean, until we have Star Trek tricorders, I don't think anybody's actually going to have a device that they're happy with. They claim to have these things like saliva based and all these things to measure this stuff, but there really isn't a technology that's going to come along and fill this gap. This is one of the conundrums of this policy. We also know that when we legalize adult use cannabis, that that it's not like people haven't been driving around with marijuana in their system for like years. And we do have a lot of data. I mean, we don't see that people get into more accidents per se and all these things. Again, AAA wants to scare people during these campaigns, but the hard data on this stuff is not compelling us to come up with a way. I think that this is one of the arguments that often comes up around legalization. But once it's done, like here in New Jersey, like we didn't really define all this stuff, and the legislature and the police are not rushing to define it here. So they don't see it. I don't perceive it as a huge problem out there on the roadways. It's a policy debate, and it's one of those things that they try and throw out there as a scare tactic. But the reality of the data there is tough. And again, until we have a Star Trek tricorder, I'm not sure that we're going to have the technology to really meet everybody's concerns.
And to that point as well, too, I was actually looking through prior to this kind of in preparation, looking through the national normal site, talking about kind of all of the research studies that they've cited. And it kind of seems to be following similar trends of kind of teen and underage use. There's a lot of statistically insignificant increases in it. But like I said, it's statistically insignificant. There are also plenty of those as well that show statistically insignificant decreases in DUIs post legalization. But then you also have like confounding factors such as police are now more acutely aware of to be looking for cannabis intoxication in people, cannabis tourism of people driving under influence. So kind of all of these kind of conflating factors that go along with it. Kind of interesting to see at least how that kind of general public health research is going to evolve as well. And in terms of how to each individual state, are there any other examples like that of states that have very similar or very different policies that in terms of whether it would be for zero tolerance driving or whatever it may be that would be of interest to you, whether it's public health or consumer access?
Well, it's interesting. Again, we've seen this go both ways. States like Colorado took 8 years to address the DUI question in any way, to set thresholds of any level. But to be clear, every state has a law on the books already that says it's illegal to drive intoxicated on marijuana. The question is, how do we refine that after we change policy on when it comes to medical cannabis or adult use cannabis? That's the big question. So no state has gotten rid of all of the rules against driving while THC intoxicated. Some of them have altered them, like I said, with the thresholds. I don't think that's, again, the thresholds comes from our understanding of how alcohol works. We feel okay with setting a blood alcohol threshold for breathalyzers, and that's where this model comes from. I don't think that we have a quite a fit for this. In the years of looking at this, there was an app that was developed by some folks. Gosh, I'm trying to remember the name of it. Anyway, this app helped people, consumers, cannabis consumers and medical patients who might be concerned that they would get pulled over. It helped them kind of determine if they were too intoxicated to drive. And this was through a series of like kind of game-like quiz tests. And you did the test before you smoked anything, and then you did the test before you wanted to drive. And if the performance was significantly different, it gave you an alert, said you should probably wait until, wait on driving. Maybe that kind of testing is on the roadside, like if you could give the driver an iPad or something. But again, you'd have to have a baseline on that. We just don't have, again, people want an easy fix on technology for this. And right now in Pennsylvania, they draw your blood and convict you. And that is almost as, the other thing about Pennsylvania, I think, you're asking what could change. Senator Camara Bartolotta, a Republican from mid-state, actually out near Pittsburgh, she had a bill to change this for medical patients so that they would be exempt from these DUI provisions in Pennsylvania, and it did not pass the legislature this year. So again, this is a contentious issue. Police don't want any change in how they do things. They don't want to hear, oh man, I have to take that into consideration. So there's a lot of pushback on this stuff. You're on mute, Jim.
Sorry about that.
Okay.
Got two more questions left here, and probably got only about 3 or 4 minutes for a full hour. But one of them that I had probably handled quickly is with the results of the election last night. I believe that I saw something that Democrats now control the state house within Pennsylvania.
Well, I think they're still counting some returns, and nobody's conceded everything yet, but that would be a big deal. Again, we've had Republicans in control of both houses in Pennsylvania and Harrisburg for years, really now. And they've really shut down. I mean, I can tell you that there have been bipartisan bills to legalize and decriminalize cannabis every year for the last 8 years. I mean, this year there was a bill from Senator Dan Laughlin, a Republican. So the GOP hasn't just shut down Democrats who want to legalize marijuana. They've shut down Republicans who want to legalize marijuana too. It's Jake Corman and the leaders of the party out there in Harrisburg. It really came out in the gubernatorial and the Senate races. The Pennsylvania GOP is against legalization, which is weird, okay? Because a lot of the companies who operate in Pennsylvania's medical cannabis program have clear ties to other Republicans. I mean, Trulieve, which just came into Pennsylvania, is pretty well known in Florida as Matt Gaetz's marijuana company. I mean, he's a kind of notorious GOP congressman from Florida. And what was it? Canopy Growth famously has former Republican Speaker of the House and Congress, John Boehner, as one of their lobbyists. So Roger freaking Stone is in the medical cannabis industry. I mean, there are a lot of people act like it's just Democrats who are into weed, but the truth is the corporate industry of medical cannabis in America and in Pennsylvania is very closely tied to the GOP. My own theory on that is because they like, I mean, the other thing that we don't have time to discuss, but which is a fun topic, is that these medical programs are off the federal books. Because federal law hasn't changed, all of the finances for these companies is very, very opaque. And it's very hard to see into the finances of the ownership of these companies. And that may be an advantage to groups that like dark money and stuff like that. So fun times.
Great. So I think we're up on our hour here. Thank you very much, Chris, for speaking with us. For anyone interested in rewatching this or has any other questions, you can certainly find Chris through Twitter, or you can reach out to me and I can connect you via email. Also, we'll be posting this recording to our website, so feel free to go to our website. Just Google Drexel Cannabis will be the first thing that comes up. Thanks again, Chris. Thanks everyone for attending, and thank you for all your questions. Looking forward to seeing what's happening in the future.
Absolutely, Jim. Thank you. And I'll send some links by. And thanks to everyone for attending. Have a great night.